Using medications for weight loss can seem like a contentious issue for some individuals, or seem like an easy path to weight loss for others. But how can you decide whether you should be using medications on your weight loss journey? Hi, I'm Dr. Brian Young, a naturopathic doctor in Toronto. I also discuss specific weight loss drugs on this channel, so subscribe if you're interested in learning more. A question I get often from my weight loss patients is whether or not to try a particular weight loss medication. So I've compiled what I think are the 5 most common things that my patients who have taken weight loss medications wish they knew beforehand. Firstly, it's important we make it clear that I'm only referring to weight loss medications in this video. These medications are approved by health agencies like Health Canada or the FDA, specifically for use in obesity. They all require a doctor's prescription and are not available over the counter. So this would exclude any weight loss supplements, diet pills, or whatever else you can buy online without a prescription. So with that in mind, let's get into it. Your experience may vary. While it's a good idea to do your own research when you want to find out what to expect from a particular drug, it's important that you take everything you read or watch online with a grain of salt. Personal reviews or experiences present only a single person's experience with the drug. That's a sample size of only one, so their experiences may not apply to you. Even information from other clinicians like myself, who have seen many patients take these medications and have the experiences of hundreds of other patients to draw from, may not 100% accurately describe what your actual experiences may be. This is simply because everyone is different. And while experienced clinicians may be able to make slightly more accurate assumptions based on larger sample sizes, we ultimately won't be able to know how it works in you until you actually try it. So if you're starting a drug that you've heard is very effective and try it properly for a few months and it doesn't do anything for you, it might just not work for you. Many clinicians have a cutoff in which if the drug hasn't helped you to lose at least 5% of your current weight after 12 weeks on the full dose, the drug is probably not working for you. Or you might hear about a certain side effect, but when you take it yourself, you feel perfectly fine. Or vice versa, you develop an unusual or uncomfortable side effect you can't tolerate at all, despite it not being listed or mentioned in many reviews. So when you do try a weight loss medication yourself, make sure you take notes, since these notes are actually directly relevant to your personal experience. Keep this information handy in the future so you'll know a little bit more of what to expect if you see other weight loss drugs that use the same medication, or a medication with a similar mechanism of action. You still need diet and exercise. Weight loss medications help you to lose weight, but it won't be able to replace good eating habits or lifestyle habits. They can help you manage some of your eating and snacking habits, but it can't control what you decide to do. That change still needs to come from you. Some weight loss medications, particularly the ones that suppress appetite, often initially seem to be working without the implementation of good dietary and lifestyle habits. This effect seems to trick some patients into believing they don't need these habits after all. Unfortunately, that's not true. Weight loss is frequently short-lived, and the medication quickly stops working for them. It won't be until you decide to build out a good weight loss diet and lifestyle more seriously that more significant amounts of weight will come off and stay off long term. These habits are what will continue to advance your weight loss journey, even after you stop taking the medication. Weight rebound is common. While some individuals continue to take their weight loss medication if they're seeing good effects, many people are unable to take their medication forever. Some medication just stops working after a while. Others are too expensive to continue. Regardless of the reason, you might eventually have to come off your medication. Weight rebound upon discontinuation of a weight loss medication is very common. It could be caused by a rebound increase in hunger, poor appetite control without the help of the drug, or a strong return of your food cravings. In any case, you'll need a plan in place to manage weight rebound when you discontinue your medication. One strategy is to create and maintain a consistent eating pattern before, during, and after stopping your weight loss drug. For example, if you only had a coffee for breakfast ate a medium-sized pre-prepared lunch, and had a small portion-controlled dinner, and made sure that you drank coffee or water if you felt hungry in between meals, maintain this schedule as best you can while you transition out of the medication. Lacking a dietary and lifestyle weight loss plan, or just doing things on the fly, is not going to do your weight any favors when your appetite and hunger starts to change unpredictably. Another strategy is to prepare other weight loss plans to fall back onto that aren't medication. For example, if you know increased hunger will be an issue, you could start increasing your dietary intake of fats and proteins, or start taking a soluble fiber supplement to help stimulate fullness better if the hunger pangs start to rebound. Know that discontinuing your medication will be more likely to cause some weight regain if you 1. Aren't prepared for it, and 2. Didn't bother developing good dietary and lifestyle habits while you were on the medication. Get professional support. Although it may be tempting to start the medication and try it on your own, I strongly recommend you find a clinician that is experienced in treating patients on weight loss medications to help keep you on track, tweak your dose if needed, as well as monitor you for any issues that may arise. The first step is usually to see your doctor and obtain a legitimate prescription for your weight loss medication. Drugs used to support weight loss often come with a litany of side effects and contraindications. There are also many things that can make the weight loss drug ineffective or even dangerous for you to use depending on your medical history. A prescription from a qualified physician will help minimize these risks. You should also be seeking continual support while you take your medication. A clinician should be following up with you and ensuring the drug is still working properly and isn't going to harm you long term. For example, if your physician prescribes phentermine, someone should also be monitoring your cardiovascular outcomes like blood pressure and heart rate. Or if your physician prescribes Saxenda, your thyroid may need to be monitored. Be open to alternatives. While it's important to research about a drug yourself so you can make an informed and rational decision, be careful not to become too fixated on a particular drug. When you ask your doctor about a particular drug, listen to what your doctor has to say. Sometimes they may suggest alternatives to the drug that you're looking for. Maybe the alternatives are cheaper or easier to obtain. Maybe the drug that you're looking for isn't safe or effective for you. Other times, clinicians will suggest you try something else before starting medication. Listen to their rationale, especially if they've evaluated your medical history. Of course, you don't have to follow everything they say, but it's important you're at least open to trying some of those suggestions if it makes sense to you. Let me know in the comments down below about some of your own experiences with weight loss medications, and if you found this video helpful, please leave me a like. As before, I'm Dr. Brian Young, bringing you weight loss info on this channel. Subscribe and hit the notification bell if you're interested in learning more, and share it with someone you know can use the help.